Have you ever looked at a loved one and felt something had subtly changed? Something you couldn't quite explain, but deep down you knew wasn't just getting older. We often think that death in old age arrives like a sudden visitor knocking quietly in the night. But in truth, the body begins whispering long before that day comes. It leaves behind a trail of clues, soft, quiet signals that something deeper is unfolding. The tragedy. Most people miss them. And by the time we recognize them, it's too late to prepare. Too late to truly say goodbye. In this video, we're going to uncover 5 powerful signs that often appear a year before an elderly loved one passes away. These signs are not always dramatic. In fact, they often start small, so small, they're easy to dismiss. But they matter, and recognizing them could help you provide better care, create meaningful memories, and offer your loved one something priceless: comfort, dignity, and peace in their final journey. So stay with us until the end. This knowledge may not only give you emotional clarity, it may also empower you to walk this path with more compassion, courage, and grace. Now let's begin. 1. Significant and unintentional weight loss. One of the earliest and most telling signs that a person may be approaching the final year of their life is sudden, unintentional weight loss. At first, it might go unnoticed. A slightly looser belt, a favorite blouse hanging a bit differently, or a loved one casually saying they're just not hungry lately. It's tempting to brush it off as typical aging or a change in habits. But don't be fooled, this kind of weight loss is rarely harmless. When the body begins to shed weight without effort, it's often a signal that something is shifting beneath the surface. Nutrient absorption might be failing. Muscle mass could be rapidly declining. Vital systems are no longer functioning at full strength. And although some muscle loss is normal with aging, rapid or consistent weight loss without explanation usually means the body is no longer processing food or protein efficiently, leading to muscle wasting and ultimately physical frailty. This decline in strength isn't just about looking thinner. It affects everything: mobility, balance, immunity, and overall resilience. An elderly person with weakened muscles becomes more prone to falls, more vulnerable to infections, and less able to bounce back from illness or injury. Why does this happen? There are multiple layers to it. First, there's the issue of appetite. Many seniors experience a fading desire to eat. Meals that once brought joy now taste bland. Their sense of hunger fades. Portions shrink. They begin skipping meals not because they choose to, but because their body stops asking for food. It's not a mental choice, it's a physical shutdown. The body knows it's preparing for transition, and the brain follows suit. Then there's the presence of chronic conditions: cancer, heart failure, kidney disease, or even cognitive disorders like dementia or depression. These conditions often trigger weight loss well before their more dramatic symptoms appear. Depression in particular can silently drain motivation to eat or engage in self-care, causing a steady spiral of physical decline. Naturally, families try to intervene. They bring favorite dishes, prepare hearty meals, buy supplements and protein shakes, doing everything they can to fix the issue. But when the body is preparing to let go, more food won't change the outcome. In fact, pressuring someone to eat large meals can cause more discomfort than relief. What helps instead? Prioritize comfort and simplicity. Soft foods, easy-to-digest meals, and lots of hydration. The goal isn't to force strength back into the body. The goal is to nurture peace in the body's final chapter. If you've noticed your loved one losing weight, eating less, or becoming noticeably weaker, don't dismiss it as just aging. It may be the body gently signaling what's to come. And recognizing this now allows you to shift your focus not to fight the process, but to walk through it with grace, compassion, and presence. 2. Deep, persistent fatigue and weakness. Another profound change that often signals the beginning of life's final phase is persistent fatigue, a bone-deep tiredness that doesn't go away with rest. This isn't the normal weariness of a long day or a bad night's sleep. This is a fatigue that lingers, intensifies, and begins to dominate daily life. At first, it might seem like your loved one is just slowing down. They nap more often. They pass on activities they used to enjoy. But soon even basic tasks, getting out of bed, brushing their teeth, making a cup of tea, begin to feel overwhelming. A walk across the living room feels like a marathon. Holding a conversation becomes too much. Why does this happen? As the body begins to shut down, it enters energy preservation mode. The heart no longer pumps with its former force. Circulation weakens. Muscles receive less oxygen. The body becomes more focused on keeping essential functions going rather than supporting movement or activity. And it's not just physical. The body's metabolic engine slows down. Energy is no longer directed outward. It's conserved. This is why your loved one may sleep more during the day, fall asleep mid-conversation, or feel fine one moment, but completely drained the next. It's the body's way of quietly preparing for rest on a deeper level. But perhaps the most heartbreaking impact of this fatigue is emotional. Seniors who once prided themselves on independence may now feel ashamed or frustrated by their inability to keep up. They might withdraw not because they've lost interest, but because they simply don't have the strength. Conversations fade. Hobbies are abandoned. Social events become too exhausting to even think about. It's not laziness. It's not disinterest. It's the beginning of the body's natural farewell. If you begin noticing this shift, if your loved one seems increasingly tired, reluctant to move, or overwhelmed by even the smallest tasks, it may be time to lean in with empathy. Offer help gently. Sit with them in silence. Be present even in the stillness. Sometimes the most powerful way to support someone in this stage is not through action, but through unspoken understanding. We just talked about how deep fatigue isn't just tiredness, it's the body's way of conserving what little energy remains. Now let's go deeper into what often follows changes in the mind, in how your loved one interacts with the world and with you. 3. Cognitive confusion and emotional withdrawal. One of the most heart-wrenching transformations in the final stages of life isn't always physical. It happens quietly in the mind. Someone who once told stories with perfect clarity, who laughed easily and remembered every birthday may begin to forget where they are, repeat themselves, or withdraw completely from those they love. These moments are subtle at first. Maybe they pause longer during conversations or forget why they walked into a room. But over time, these changes begin to form a pattern. It's easy to mistake this for simple forgetfulness, the kind we all experience. But what you're witnessing might be something more profound, a gradual dimming of cognitive function as the brain starts receiving less oxygen and fewer nutrients. Just like the muscles weaken with age, so too does the mind. You may notice them asking the same question several times in a short span, forgetting familiar names or misplacing objects in odd places. Even more striking, they may become disoriented in their own home or seem unsure of what day or season it is. These aren't just signs of getting older. They're often early markers that the body is entering its final chapter. Sometimes this confusion comes and goes. Your loved one might have a clear and joyful conversation one moment, then drift into silence, staring off with a vacant expression. It can feel like watching someone fade in and out of reality, as though a veil is being slowly drawn between the world and their awareness. But it's not just confusion. Emotional withdrawal is just as common and just as painful to witness. You might notice they stop joining family conversations, become quiet at the dinner table, or prefer sitting alone in silence. Not because they're upset, but because engaging simply takes too much effort. Loud noises, fast-paced conversations, and social stimulation can feel overwhelming. Their world becomes quieter, slower, more internal. Some people become more irritable or anxious. Others seem unusually calm, almost indifferent. They may no longer react to news that once excited or upset them. That's not because they don't care. It's because their brain can no longer process emotions and stimuli the way it used to. The body is retreating inward, and the mind follows. For family members, this can be one of the most emotionally challenging times. It's not just the loss of physical vitality, it's the fading of personality, of connection. Watching a loved one who was once vibrant and present become confused or distant can feel like losing them before they're truly gone. But it's crucial to remember this isn't their choice. It's not something they can control. And it's not a reflection of how much they love you. Instead of trying to force conversations or pull them back into the world, meet them where they are. Speak softly. Sit beside them, even in silence. Offer your hand. A familiar song, the scent of a favorite meal, or even the sound of your voice can still bring comfort, even if they can't respond with words. If your loved one is becoming more forgetful, more confused, or more distant, don't dismiss it. These signs often appear months before the end of life and serve as a gentle reminder that the body and mind are preparing for transition. It's a time for patience, a time for love expressed not through grand gestures, but through presence, through stillness, through peace. So cherish the quiet moments. Play the music they loved, let them rest, because even when the words disappear, the feeling of being loved remains. As the mind and spirit begin to retreat inward, the body often starts showing more outward physical signs of this transition. And one of the clearest is how the immune system begins to falter. 4. Frequent infections and slow healing. Have you noticed your loved one catching colds more often? A lingering cough that won't go away? A bruise that seems to take weeks to fade? These may not be isolated events. When the immune system begins to weaken, it often signals that the body is no longer able to protect or repair itself the way it once could. What once would have been a minor illness, a sore throat, a skin infection, a small cut suddenly becomes a lingering concern. The body takes longer to recover. Healing slows down. And unfortunately, this is often more than just a side effect of aging. It's a clear indicator that the body is shifting into a phase of decline and surrender. Some of the most common issues include recurring urinary tract infections, UTIs, pneumonia, skin sores, or even oral infections that seem unusually persistent. Families often assume these are just common illnesses that come with age. But when these infections become frequent or take longer and longer to heal, it's usually a deeper sign the body can no longer fight back effectively. You might notice that antibiotics, which once worked in just a few days, now take multiple rounds. The fever goes down but comes back. The same issue resurfaces weeks later. These are not coincidences, they're clues that the immune system is losing its strength. Another sign, slow wound healing, a small scrape from a table edge, a pressure sore from lying in bed, a bruise that darkens and lingers. These are all signs that circulation is compromised. Blood isn't reaching the tissues efficiently anymore, which means oxygen and nutrients aren't doing their job. For those who are bedridden or less mobile, pressure sores become a serious risk. Without constant repositioning and careful care, they can worsen quickly and lead to severe infections, sometimes even becoming life-threatening. What makes this stage especially delicate is that infections, even mild ones, can cause sudden and rapid declines. A low-grade fever might seem harmless at first, but can lead to delirium, dehydration, or hospitalization in a matter of hours. At this point, the focus of care often shifts. It's no longer about aggressively treating every illness with the expectation of full recovery. Instead, it becomes about comfort-focused care, relieving discomfort, preventing suffering, and protecting quality of life. Families may struggle with this emotionally, especially if they've always believed in fighting hard and holding on. But recognizing that the body is preparing for peace, not battle, can shift the way you show up. Sometimes choosing less intervention and more tenderness is the bravest and most compassionate path. As we've seen, recurring infections and slow healing are signs that the body is no longer fighting as it once did. But in the final phase of life, changes become even more profound, especially in how the body breathes and circulates blood. These signs may seem subtle at first, but they often signal that the journey is nearing its end. 5 major changes in breathing or circulation. One of the clearest signs that the body is entering its final stage is a noticeable shift in breathing and circulation. These changes don't always look like the dramatic episodes we see in movies. Instead of gasping or collapsing, the body quietly begins to wind down. You might observe that your loved one is breathing more slowly, more shallowly. There may be unexpected pauses between breaths, moments when you catch yourself holding your own breath, waiting for theirs to return. Sometimes the pattern becomes irregular, rushing for a few seconds, then slowing to almost nothing. This pattern, known as Cheney-Stokes respiration, is common in people approaching the end of life. It sounds rhythmic and gentle, yet carries the weight of the body's final rhythm. At first, these changes might go unnoticed, but over time they grow more frequent and more apparent. Equally telling is weakened circulation. You may touch their hand and find it cold, even if the room is warm. Their feet, fingers, nose, or ears may begin to feel chilled or appear bluish or mottled. The skin might lose its usual color and look pale, especially around the extremities. This happens because the body, knowing its energy is limited, redirects blood away from the arms and legs to protect the vital organs, the heart, brain, lungs. It's the body's way of choosing survival for just a little longer. Breathing changes can also show up in daily activities. Your loved one may begin to feel short of breath after something as simple as sitting up in bed, turning over, or speaking a few sentences. You might notice they now breathe through their mouth more often or pause mid-conversation to catch their breath. If they were once able to walk across the room, they may now struggle to stand without feeling winded. Another cause is fluid buildup in the lungs. This can make breathing more difficult and may lead to symptoms like a persistent cough, gurgling sounds when they exhale, or a feeling of tightness in the chest. Family members often mistake this for a cold or simple congestion, but in older adults nearing the end of life, it's usually something deeper, a sign that the lungs are no longer functioning at full capacity. They may even find lying flat uncomfortable and begin preferring to sleep propped up on pillows or in a recliner positions that allow for easier breathing and less strain on the chest. For loved ones watching these changes unfold, it can be overwhelming. It's natural to feel alarmed. You might instinctively want to encourage deeper breathing or worry that something urgent is happening. But often these patterns aren't emergencies, they're part of the natural unwinding of life. At this stage, it becomes less about reversing symptoms and more about easing them. Simple actions can make a world of difference, keeping the room cool and well ventilated, using a humidifier to keep the air moist. Gently moistening their lips or offering small sips of water to soothe dry throats. In some cases, medications or oxygen support can help ease discomfort, but the focus shifts from curing to comforting. If you notice breathing that is slowing, stopping, and starting, or if your loved one's hands and feet become cold, discolored, or mottled, don't ignore it. These are signs the body is transitioning into its final stage, preserving its last reserves of energy. It is a sacred and tender time. What they need most isn't urgency, it's not intervention, it's presence. Be there, hold their hand, let them feel your steady presence beside them. Speak softly even if they don't respond. Offer reassurance, not pressure, comfort, not correction. In these final moments, your quiet love is the most powerful medicine. Now that we've explored the 5 major signs — significant weight loss, extreme fatigue, cognitive decline, frequent infections, and changes in breathing and circulation — it's important to take a moment to reflect on what this truly means. The final year of life doesn't always come with sirens or warnings. More often, it begins with a whisper, small signs that, when put together, tell a powerful story. A story not of weakness, but of transition. A body slowly letting go. A soul preparing for peace. These signs rarely arrive all at once. They may appear gradually, unfolding over months, or come in waves. And for families, it's not always easy to accept. It's tempting to push back, to urge a loved one to eat more, to move more, to stay the person they've always been. But there comes a moment when the most loving act is to stop pushing and start listening. This isn't about giving up. It's about leaning in. Recognizing these signs allows you to make decisions ahead of time, to create moments of connection, and to ensure that this final chapter is written with love and dignity. You can prioritize comfort over intervention, peace over panic, presence over performance. It's in these moments that the smallest gestures become the most meaningful: a warm blanket, a favorite song, a shared memory, a simple "I'm here." So, if you're noticing these signs in someone you love, take a deep breath. You are not alone on this path. Countless families have walked it before. It is difficult, yes, but it is also sacred. And knowing what to expect can help you walk through it with grace, patience, and peace. If this video has helped you in any way, we invite you to share one thing you've learned in the comments below. Let us know how you're planning to use this insight with the people you love. Your story might bring comfort to someone else walking the same road. If you haven't already, please subscribe and click the bell icon so you don't miss future videos. Your support helps us continue creating content that informs, comforts, and uplifts. Thank you for being here. Thank you for caring. And we'll see you in the next video.